This is Chang from All4Cure. Today, I'll be sharing a clip from our virtual rounds of our team discussing MM-1054's dashboard. During these virtual rounds, we try and discuss each patient's case to try and come up with ways to help each patient. Please note, All4Cure does not provide medical advice, but merely suggestions that the patient and his or her doctor may want to consider.
He was diagnosed with ISIS stage 1 lambda light chain myeloma in January 2011. He had presented with back pain and was found to have a compression fracture of the T5. His bone marrow biopsy showed 50 to 60% plasma cells by morphology and 19% myeloma cells by flow cytometry. He received radiation to his back and started treatment with Velcade and Decadron. And then he had a stem cell transplant in June 2011. He started maintenance therapy with Revlimid, but was only able to tolerate it he wasn't able to tolerate it, so he discontinued it after 2 weeks. And then he was just under observation for a while until his light chain levels increased to where he started treatment with Revlimid and Decadron in December 2013. And then he added Cytoxin to his treatment in August 2014 due to his increasing lambda-free light chains. And then he switched treatment to Ninlaro and Decadron in May 2016 because his lambda-free light chains continued to increase, or they went down and then increased again. And then he switched to Pomalyst and Decadron in April 2019, and then added Darzalex to the treatment in May 2019. And he's still continuing with that treatment as of January 2020.
Okay. And when we reviewed him, reviewed his situation last time, did we have any comments for? So it looks like the patient's given two items that need correction. Yes. So, and we've corrected his dashboard based on this input. Is that right, Jane?
Yes.
Okay, good.
So it doesn't look like we had any suggestions for him, but we might suggest looking into clinical trials sooner than later if his disease burden increases because he's progressed and relapsed a couple of times already.
Yeah. And so we discussed that at the last time we reviewed his dashboard.
Yes.
Yeah, and it looks like I haven't yet provided that input, but he lives in Indiana. Rafat Abenauer is a world-renowned myeloma expert there. Is he seen in Indianapolis at IU?
Yes, he is seen at IU. Let me see who his doctor is. He's seen by a Dr. Ataya Suvanasanka at IU.
Okay, great. So he's tied into the IU system. Sometimes you can see with the pomalidomide, Dara, Decadron combination, you can sometimes run into problems with low neutrophil counts. His neutrophil count's doing okay. It looks low here because it's all normalized to this very high value that he had when he got his stem cells mobilized. That's totally normal. But his neutrophil count's okay. His platelet count's okay. So it looks like, on the low side, but doing okay, 95,000. But I think, yeah, what you mentioned at the end here is really the main point is it would be really great to use this period of responsiveness to the current drug regimen as an opportunity to very kind of carefully, thoroughly investigate clinical trial options. And do we, by chance, have a sense of what kind of myeloma clinical trials might be available at IU? His doctors will know we're not going to add a lot of value by providing that information since they're already at IU. But for our edification, I wonder if we could just see what kind of options might be available for him. So let's see, they have this. So myeloma, United States. Let's see. Yeah. Okay. State is Indiana. And search. And then we want active. We want recruiting. Let's see, or not yet recruiting, because it doesn't need to be on a clinical trial right now. It's just kind of trying to forecast what kind of studies are going on there. Okay, so I don't. Collection of specimens, first in human. Oh, this is the BITE study, is that right? REGN 5459. So we have patients, it seems like, that have had good responses to that. Is that, or at least a patient who seems to have responded to this clinical trial? Is that true?
Yeah, MM-519 is doing really well on this trial.
Okay, let's just look real quickly. And that's, yeah, there you go. So this decline in lambda-free light chains and in response to this drug looks great. And this is the patient that posted a comment feeling where the patient really feels like this had a, yeah, I'm so thankful that I'm in this study. That's a pretty strong endorsement. So, you know, every patient's different, of course. MM-519's response to this treatment doesn't at all mean that MM-1054 would respond, but it's some information that would be relevant, I think, and if I were MM-1054 and thinking about my relative enthusiasm for this. So this is a trial. So I think just, again, this isn't a trial that MM-1054 needs to be on now. Certainly, he's responding to current treatment, but again, if things start not working as well as one might hope, then it could be definitely up for consideration. And then let's see, what else do we have here? Maintenance, lenalidomide without risk smoldering, recruiting study. This one I'm not as familiar with. It's involving, you know, pembrolizumab, which isn't a, you know, there's been a lot of interest in its use. There were some early complications in patients treated with pembrolizumab that reduced the overall level of enthusiasm for its use in multiple myeloma, but I think there has been some renewed interest. And I had heard somewhere that there weren't any active trials of pembrolizumab in myeloma, and this suggests that what I had heard is wrong, and that at least here there is a trial that could be considered, that could be also, I think, potentially very interesting, especially if this is now, this is a GSK drug. There's been, and I know there's a GSK drug in myeloma that's gotten a lot of attention. Let's see. Yeah, an antibody drug conjugate that I think has also had, there's been quite a lot of enthusiasm for this. So I would say, you know, that's another pretty reasonable option for. So it sounds like there are potentially two good options clinical trial wise that would, you know, could be of interest in this patient. This is another, looks like this is another trial of the same drug. This is a CAR T-cell trial. So I think the nice thing is there are options that locally for clinical trials that this patient could participate in. I think this is another CD38 antibody, if I remember right, TAC-079. So something analogous to daratumumab, isatuximab. Let me make sure that I'm right about this. So TAC-079. So they have a nice repertoire of clinical trials that I think would be really, compelling. Yeah. So high affinity monoclonal antibody binding CD38. So they have a number of clinical trials that could be considered for this patient. So I feel pretty good about his ability to access these trials if he needs them. So, okay. And then I guess the last question I'd have is, what's going on with his bones now, Jane?
Let's see. Well, he recently reported bilateral hip pain and right shoulder tenderness at his last appointment in January. This was on January 18, 2020. So he plans to have an MRI, but it looks like before that, his most recent imaging was in February 2019, and it didn't show any evidence of FDG avid malignancy.
Okay. Yeah, so then the other question would be whether or not to resume Zometa if he has recurrence of bone disease. And with that, I think he's had a fair amount of treatment, whether he and his doctor might want to consider resuming Zometa now, since he's had, active disease, it's continuing treatment. That would, I think, be another question.
We very much welcome comments and questions by the community. Please like our Facebook page and subscribe to our YouTube channel if you'd like to follow us for more content. If you are a myeloma patient, we welcome your participation on All4Cure. Thank you for watching.